Many Minnesotans rely on employer health care coverage and are losing that coverage due to layoffs. Good health care is crucial during this pandemic. What will you do about this? Jason Isaacson.
What's really unfortunate about this situation, and maybe in the long run, it'll be our wake-up call, is that what the COVID crisis has really done is exacerbated and put a focus on where our inequities and problems with access and costs are in healthcare. You know, I've been on that committee now for 3 years, and it has been nothing but a sobering experience to be on the healthcare committee, to see just not only the problems we have with healthcare, but our inability to wrangle this beast has been really difficult. You know, and I never thought of Obamacare as this panacea that was going to solve our problems. But the reality is until we have an honest conversation about how we're paying for it and how much we're paying and setting the prices, everything else is window dressing, right? And so certainly we should go forward, as Ben had talked about, we should go forward with making sure there's an option for folks so they don't fall through the cracks, because we all know prevention is better than cure. If someone has the insurance, we're going to spend less money up front than we do in the long run, right? And the universal model of healthcare has existed for a long time. It's called the emergency room, which gives you the worst outcomes for the most expensive costs. And it is the worst way for us to operate. And we continue to operate with that kind of cure-based model in our healthcare system. And that's where there needs to be stunning reforms for that, so we can save the money and spend it in the places that it really matters. When it comes to folks that are going to lose their healthcare, we have to absolutely make sure there's an option for them. We have to make sure that we don't allow anybody to slip to the safety net. That should not be a reason for people to go bankrupt or broke. And as a state, we can afford to do that. And I think that should be absolutely one of our priorities.